how you doing? Good to see you.
Great to see you.
Can you both just introduce yourself?
Okay.
Your name and then
I'm Dr. Kathy Ann Joseph. I'm a breast surgeon. I'm professor of surgery and population health at NYU Langone Health. And I'm vice chair of diversity and health equity in the Department of Surgery and Transplant Institute at NYU Langone Medical Center.
I'm Latoya Williams, survivor speaker. I'm also the senior manager for cancer control strategic partnerships at the American Cancer Society and a trained health equity champion.
So we met at a sorority chapter meeting. It was my first meeting at our graduate chapter. And I remember during the meeting, you were saying that you were working on a program, and the person that you were hoping would speak at this outreach event for Breast Cancer Awareness Month in October, it fell through and you needed a speaker. It was called, I think, Power Pink and Prayer. And I was like, wait, I'm a breast surgeon. This is what I do. And I remember coming up to you after the meeting and just introducing myself and saying that if there was something I could do to help, I'd be happy to. I think I spoke at your event and we've become friends since then, right?
Right. I remember that day so clearly, at least in my head I do. And I can't believe it's been a decade since we met, since we had that meeting. That is so cool. We had about, 60 women that showed up to the Power of Pink and Prayer. And ironically, there were some women sitting in that audience with lumps in their breast, did not know where to go, and we showed up and showed out. So I'm so glad that you agreed to partner with me and have been my partner in crime ever since.
Yeah,
we
it
did.
really has.
So I guess you could say my first exposure to breast cancer was when I was 13, watching both my grandmothers battle breast cancer at the same time and unfortunately succumb to this insidious disease just 8 months apart. So in my young mind, cancer equaled death. But ironically, I also found my first breast lump at that same age of 13. It turned out to be benign fibroadenoma, but just learning how to check my body that early in life, I felt was preparing me for what was to come 17 years later. So yes, I was diagnosed officially at the age of 30, and I was checking my breast in the shower, found a lump, and knew exactly what to do, which was to go to the doctor. I also feel like after going through the whole diagnosis and coming out on the other side, it actually changed me and propelled me to actually embrace a new career working in the cancer world. So I look at it as like mission, passion, and God liberating my mind. It's not just a job to me, it's my calling. So that's my connection to cancer. What's your connection?
My connection is that I have had many, when I say many, many family members who've had cancer. Unfortunately, many who have died from cancer, many who survived, but many who have died, including my own mother. And she was diagnosed when I was in the 5th grade. I was 10 years old, and she was a nurse. And at the time, I didn't even really fully understand or really what that meant. And they kind of kept a lot from me at that age. She would be sick, and she was in the hospital. Then she'd come home, and she'd be fine, and she'd go back to work. But around the time that I was in high school or heading towards college, it was clear to me she was not doing well. And she ultimately passed away when I was a freshman in college. And that had a huge impact on me. I think when you get older and you have your own children, you think back about, just the sacrifices she made. She worked nights, so she could be home during the day to take care of us. I don't think my mom ever got a full 8 hours of sleep.
Wow.
You have to take care of yourself before you can take care of someone else. You got to put that oxygen mask on. first, and then you put it on your child.
Cancer impacts the entire family, not just that patient.
Yes.
So I think self-care is something we need to really, really, really promote in the cancer space as well.
My patients will say, well, I don't want my kids to know. I'm like, they know something's going on. You know, and so you should talk to them and see how they're feeling about it. Kids know. I know I knew. You know, when I was in college, between my junior and senior years, I had the opportunity to work with a public health researcher at Columbia. And she was doing her doctoral research on elderly African American women. She was working at Harlem Hospital, and she was screening women over the age of 65 for breast and cervical cancer. And many of these women had never even had a pap smear, never had a mammogram. And I just thought that was just eye-opening to me that, you know, these are women that were part of the healthcare system and yet hadn't had these screening tests done. And so I talked to her and I said, you know, I was a sociology major in college. And I said, could I interview these women? And she said, sure. It was just so eye-opening to me as I don't know, I think might have been 19 at the time, to hear these women's stories and to document them. And I remember talking to my advisor about how these women were just sort of part of this whole system, healthcare system, that really wasn't necessarily serving their best interests. And my thesis became called Triple Jeopardy, you know, poor, elderly, and Black.
Wow.
Yeah, it really actually transformed, and I think I didn't know it at the time, but it started me on this whole trajectory of public health.
That is so powerful, how experiences shape your future and your purpose.
Yeah.
Wow.
Walk with purpose to me means every day doing my very best to help patients, to help people, that I'm making a difference, whether it is in the clinic, when I'm taking care of patients, or out in the community with my navigation program, where I supervise a team of navigators that are going out and educating. I wake up and I say, what am I going to do to make a change? And I can go to bed and say, I've done my very best for the day. And also, everyone that I interact with in the medical setting, whether it's the residents, the students, that they also understand the importance of not just treating patients, but equity, how important it is to consider that when you have a patient in front of you, that they're a person.
Walk with purpose means to me shedding the old me and rising from the ashes like a phoenix. And what I mean by that is not only did I learn my voice through this whole experience, but I really learned how to stand up for myself, stand up for others, because when I see something that's being done wrong or not equitable, I am not going to be that person that sits there silently and allow that to happen. I want to be the change that I want to see in the world. So walk with purpose to me means standing up for change, standing up for what's right, helping those who have not found their voice yet, helping them to find their voice. Realizing that just because you got diagnosed with cancer, that is only one chapter of your life. You still have a whole life to live, and I want to inspire people to do just that. Turn that tragedy into triumph and soar like an eagle into living your best life. So that's what walk with purpose means to me.